thank you, Devin. And we all are known to moisten our mouths when we are feeling a little dry, perhaps. But what about when there's too much saliva in our mouth? Yes, here this morning to tell us about hypersalivation is Nurse Christina Paris. Thanks for joining us this morning.
Hi, good morning. I thought after the really heavy topics we've had lately, we needed something a little more light.
Exactly, something we can all, easily relate to perhaps here. But tell us the role of saliva and what hypersalivation is. Exactly.
Sure, right. So saliva is really important. It's mainly water, but it has some enzymes too. And it has a lot of, it plays a lot of roles in our mouth. It keeps your mouth moist, of course, as you had talked about, so that nothing sticks together. It's nothing worse than having a cotton mouth or a dry mouth. It moistens our food and helps us to chew and makes things easier to swallow. Helps in digestion too.
Maybe flavor too, right? Does saliva help with flavor?
It does help with flavor. Yep, it does. And it also has different enzymes like amylase, which kind of breaks down food and helps with digestion. And it helps to protect against infection. It has like antibacterial properties to it as well. And like in repairing tissue too. So saliva has particles or different enzymes and things that can help repair, like if we bite our cheek, things like that. So it can help repair tissue. So it has a lot of properties.
So interesting. It can help like heal a canker sore, even though it takes forever for those to heal a lot of times.
It can, yeah. It can keep it protected. I mean, just imagine if there was nothing and it was dry in there. It would be very hard
It'd be very painful.
Right. Uncomfortable. So yes. So hypersalivation is just an overproduction of saliva.
Okay.
You can have hyposalivation as well, which is an underproduction of saliva, and so that can be uncomfortable too, as we said.
And how would these be diagnosed then?
So typically, what you'll do is go into your doctor, talk to him or her about your symptoms. So it's typally based on signs and symptoms, and then you just, can go from there depending on, they'll look at different things. So there's different causes, if you have things like ALS, if you had a stroke, some people with just cavities can get hypersalivation, right? Wow. So if your teeth, so there's other infections, acid reflux, things like that can cause it as well.
Oh, that's kind of terrifying, because I know every now and again I get that burning sometimes in my stomach too. Depends on the food at times. I have to take like Tums sometimes to calm that down. So I don't know, I'm going to have to watch that acid reflux part now. But I know any cavities I've had removed have been grinding cavities. I guess I grind in my sleep. That's a whole different topic.
It is.
But anyway, you mentioned the hypersalivation. So are there treatments available for that?
There are. So a lot of times it's just based on what's going on. So at home, if it's a cavity, keeping your mouth clean, making sure you brush at least twice a day, that can help keep those infections down. There are medications that you can take, like scopolamine, which we take for nausea, that also can cause dry mouth. Atropine, that can do it as well. And then there's, you can do surgical interventions, radiology can also do some interventions, and Botox injections.
That would help.
Can help as well.
How would Botox help make more saliva?
So what it numbs the glands, the nerves that would constantly produce it. And in interventional radiology, that's kind of what they do too. They'll go in and kind of cauterize the glands.
That's cool.
So you have two salivary glands underneath, and then one on like the sides of your cheeks too that release saliva.
Well, very cool. Learned a lot about hypersalivation, the saliva glands around here. That's kind of neat.
Yeah, and some kids too can have it. They may have excessive drooling. And so, that's another issue, but you can use speech therapy, can help with that, and they talked about the interventional radiology with that as well.
Well, great. It sounds like there's things that people can do if they find themselves in these sorts of situations.
Yes, absolutely.
Well, fantastic. Thanks for coming on and talking to us about this. Appreciate the little bit of information that we get, and we're a little bit more knowledgeable now about this. Thanks so much.
That's right.
Thank you.
All right, but coming up, we have What's Trending, including a special